Welcome back from the short break, and you are still watching Sunrise at Sea here on CTV. Welcome to Twitter Jabs too. My name is Agi Oase, and today we are right now we are carrying on with the conversation of Mental Health Awareness Week. And this year, the Mental Health Foundation has put aside or set aside the theme as loneliness. And joining me at the center of this conversation are two guests who will be weighing in and also giving us more insight and deliberating on this particular matter. And seated right next to me is Miss Rosette Ekiansimira, who is a clinical psychologist and a CEO, Epignosis Rehabilitation Center, Entebbe, also known as Katunkuma. I find that very, very intriguing. And to my far right, that is Mr. Albert Elwa Luis, who is an addiction professional and a director focused on Recovery Uganda, and as well as Tranquil Homes. Did I get that right? Thank you so much for joining us today on Sunrise at Sea.
My pleasure.
Well, for my first question, as mental health experts, what is your perspective on mental health?
Thank you. Thank you for introducing me. Mental health, when people think about mental health, they look at maybe mad people. But mental health, World Health Organization defines mental health as behavior, cognitive, and social well-being of an individual. So it has nothing to do like madness and all that. So because most people, when you say mental health, they look at a mad person. No, it entails your behavior, it entails your cognitive and your social well-being.
Yes.
Yeah.
How about you, Mr. Alvin?
Thank you. Good morning, viewers. Yes, like Rosette has rightly put it, mental health is your state of general functionality. It involves your psychological state, physical state, how you behave with others, you know. And if these functionalities are affected or impaired in one way or the other, that's when, and if it's very significant, that's when we start looking towards what? Mental illness.
Yes.
Yeah, but if you're functioning well or at least above average, then that is a state of mental health.
Okay, well, we see that the Mental Health Awareness Month, commemoration of the World Mental Health Awareness Month and Week, started in 1949 in the US, and we have seen so many countries, the UK, among other countries, you know, getting on this wave of commemorating Mental Health Awareness Week. In your perspective, do you think that the concept of celebrating or commemorating the Mental Health Awareness Week and Month has been grasped rather yet in this country, in Uganda?
Increasingly, yes. I mean, there are so many activists coming into this space, like we are here. The Ministry of Health has gotten more involved since 2015. The advent of social media has exposed us to the effects of poor mental health the world over. So this is a rising concern, because nowadays there's a platform to share people's grievances, people's experiences around the world. So I feel that, yes, even if it started in 1949, for Uganda in particular, it's hardly a decade. We've just seen a rise in attention in the last probably 5-7 years. Yeah.
Okay, how about you?
I believe so, but according to me as Rosette, it is, I can maybe rate it like 30%. Because like we are neglecting the core. Because when people are talking about mental health, we are not looking at the root causes. And as an individual, I'm looking at, we should consider the very things that cause mental health.
Yes.
We are talking about it in general. This, but we are not looking at the root causes. And you understand, when you don't solve that problem from the root cause, these are just like leaves of which you keep pruning, and all the problem keeps on escalating. So to me, I will rate it at 30%. Yes.
So we've just only done about 30% in Uganda.
Yes.
Well, it looks like we still have a long way to go. But moving on with this conversation, this year the Mental Health Foundation did announce that the theme is loneliness.
Yes.
So I'd like you to weigh in on the conversation of loneliness. Do you think it's the right theme this year, or do you think that loneliness has actually impacted negatively, besides every other factor, on mental health?
Yes, I do believe. When we look at loneliness, we need to define what is loneliness. There is loneliness, then there is isolation. So we need to know which one is which. But to me, as someone who has studied psychology, loneliness is not actually when we are old. It starts way back when a child is young. In psychology, we believe personality forms from the age of, from conception up to 12 years. That is puberty stage. And through when this child is growing, there are different stages of life where you're supposed to learn how to interact with the community. So if a child is deprived of that chance, it's hard that you're going actually to be isolated, or you're going to be lonely. You're who you are not because of education. Education contributed a small percentage. Actually, out of 100, I would say maybe 40%. But you to choose to be a journalist, for Albert to choose to be, for Rosette to choose to be an accountant, it came way back when we were born, from the stages of life. You get it? So the way we raise our children, the childhood experiences we get, they form who we are. So by the time you say someone is lonely, it has not started today. It started way back when this child was young. The interaction you used to get with your fellow peers, maybe at 4 at 5 years, who are you the child who used to be closed inside? That right now you don't have any skill of relating with someone.
Yes.
You get it? Are you this child always who had the mother only? Are you this child who always raised by a single parent? Are you this child who always had the video games? You get it? And you couldn't interact with any other person? Are you this child who was the only child in the house and you raised with all people? And right now at the age of 16 or 20, you cannot associate with your peers. You get what I mean?
Yes.
So we are who we are because of our childhood experience. So I guess loneliness, yes, a 90%. It also contributes to what? To mental health. Because the moment, as from the definition we said, social well-being. So the moment you're lonely, of course your social well-being is what? Is affected.
Yes.
Yes.
In one way or another.
Yes.
Mr. Albert, I'd like to ask you, do you think that the Mental Health Foundation chose the right theme this year, loneliness?
I think so, especially in the aftermath of COVID. Because COVID led to a lot of lockdown around the world. So there is a strong sense of social disconnectedness, isolation. You know, a lot of people lost their jobs. You know, that uncertainty that keeps people locked in. You end up feeling that it is you alone against the world. So I think, yes, it was the right theme. Loneliness has always existed, but I think how we've always perceived it, how we've always perceived it has been different. Because culturally, for example, in a typical Ugandan setting, it's not something you would say some years back. You're expected to toughen up, you know, show face here and there. So you find that people suffered in silence, people got depressed and had to find their own ways of dealing with it. Because, number one, how we perceived it was different. But with increasing awareness, and you got the world getting on a universal form of understanding these challenges, loneliness is the right one, especially in the aftermath of COVID. And now that we have a deeper understanding of what loneliness is. Yeah.
And also, as we talk about loneliness, it does happen that even when you're surrounded by people, even when you wake up and go to work and you work with people, and even seated back at home and you have surrounded by family and friends, somehow you can be a lonely person. It's so true. So how do people go about that? I mean, you talked about it's the way you're raised. Were you raised as an introvert or an extrovert? But how about when you are in a situation where you are surrounded by people who can be of help, but yet again you feel empty or you feel lonely?
It goes back to your personality. There are people who are willing to ask for help, and there are people who are saying because of other factors, he will die alone or she will die alone. You get? We've had suicide cases. You had someone in the morning and everything was okay. In the evening, someone took poison.
Yeah.
So there is a possibility of being with people, but you're still alone. You get? We can be together, but it is just physical. Mentally, I'm just away. Mentally, I'm disconnected. You get what I mean?
Yes.
So being around many people, it doesn't mean that you actually psychologically connect. And this normally happens not actually even to kids, even in marriages. There are people who are actually married but they are single. It is just she or he is physically there, but the dude is single. The guy is lonely.
Yes.
You get? So there must be that interaction, which is physical, which is emotional. Like that heart-to-heart communication.
Yes.
So when it is there, it's not there. When it is in absence, of course people are single. People are lonely, I mean.
Okay.
Yes.
Mr. Albert, this is to you as a mental health professional. Let's now talk about other factors. How has addiction, especially in this country, contributed to mental health?
How has it affected mental health? Yeah, a lot. We've had an increasing number, huge increase in mental health, in mental disorders. You can see with the sprawling number of rehabilitation centers around the country. That is just to treat addictive disorders, but rarely do these addictive disorders occur alone. There will be underlying disorders, depression, anxiety disorders, and a few others. All these are due to what? Due to addiction. Definitely addiction leads to situations like dropping out of school, which affects someone's mental health, unemployment, that loss of income. It dissolves relationships. So many relationships are affected. So inevitably, addiction contributes a lot to the downward spiral, spiraling of someone's mental health. Yeah, so it's significantly contributed.
Okay, and how has the rehabilitation centers, how are they handling that?
Okay, the good thing, a good number of rehabilitation centers, I'll speak for ourselves as Tranquil Homes, have a professional setup, a multidisciplinary team, a psychiatric team, psychological team, people with experiential expertise and all that. So the setup is well equipped to handle these problems. But like we say, ours is the smallest part. Rehabilitation only does 10%. You know, the individual does, the family does 15%, and 75% is the individual. We will treat somebody, help them set up their goals, impart all these skills, but we can't control the environment outside. The person gets out, and then we cannot get you a job outside. We cannot pay your tuition outside. We might psychoeducate your family, but we are not going to force them to change their approach with you. So I think rehabilitation centers have done quite a lot. You know, it is, the problem is the perception here. When people take their loved ones to rehabilitation centers, they are looking for a magic bullet. They think automatically, if this one is treated, because I've paid some money, they should never touch.
Yes.
But this is a disease, and it's a chronic one. Unlike any other health field, we offer no guarantees. We will do our best and hope it works. But there are no guarantees. There are factors. We don't control the biggest factors that contribute to
Which are individual.
Which are individual and also which are environmental. You know, there are a lot of things that need to be put in place. A lot of relapse, for example, and this is a relapsing disease.
Yes.
You see, it's an emotional disease, it's relapsing. there are a lot of things, a lot of relapses that take place within the family. The person will come back and still find a judgmental family that dampens them emotionally, and they're forced to resort back to their previous coping means, which is using. They feel disconnected, they feel unaccepted, they are forced to go back to the social grouping that used to accept them. Unfortunately, that is a negative a coping method, and they relapse. So there are so many factors, but on the scale of 1 to 10, contribution of rehabilitation centers in Uganda today to recovery from addiction, I'll put us at a decent 50%. I'll put us, Butabika is doing a good job. Private entities are doing good jobs. So there's progress.
Okay, before we get into some of the instances or incidents that we have had in the past about, patients or mental health patients rather being treated not in a good way, we'll get to that. But I'd like to ask you, as a professional and a clinical psychologist, what do you think about the healthcare system in Uganda? Do you think it's good enough in regard to the mental health issues and mental health awareness week? Has it contributed in any way, or they are silent, they're not saying a thing about it?
They have contributed, but much has to be done. Yes, they have contributed to a certain percentage, but much has to be done. When it comes specifically to mental health, we need to do a lot of psychoeducation. As Mr. Robert has said, drug use. When you talk about addiction, of course, you talk about drug use. Most people don't know. Actually, they bring you a patient and like, we don't know. What should we do? You get, what should we do? This is our son. But as I told you, they are looking at the current state, but they don't know that actually parents and caregivers also contribute to a certain percentage to mental well-being of this person. As I told you earlier, we are who we are not because of maybe the current state. There is a progressive move, how we grow up. So sometimes I normally talk to parents when we have family session. I'm like, how did you handle this child? Like, me as a mother, I was working, the father was working, so we'd wake up in the morning, we go to office, and this child, you don't have any connection with your boy or with your girl. Even if I asked you, who is this person? You actually don't know. So the person who was very close to this child or this man, it is either maid, either an askari. You don't have any connection. Any human being, we grow, can we say, we respond to nurture and love. And I think you're able also to tell as an individual, any person who gives you love and who contributes to your nurturing, you tend to be close to them. But as parents, you are not doing that. So people think mental health, it's about the government, it's about putting hospital. No, it's supposed to be actually in families. Parents, you're actually the first people who are supposed to care for these people. You're the first therapist, not us, not rehabilitation centers. You get me?
Yes.
You just imagine someone is 30 years old, but you've never been in his life. All you do is provision. No, they are not animals. These are human beings that need nurture, love, attend to them. But these parents are telling, no, I took him to a good school, I have 3 maids. No, that is not the right thing. Actually, to me, it's not about the government, but the families. The government actually should have policies, most especially the mothers. You can just imagine I don't know, in Uganda, you're given maternity leave for only 3 months. After 3 months, you leave your child and you go back to your office. Mr. Albert can testify to me. There is what we call bonding, attachment. We are kids are totally attached from their parents. Some of these various principles are through interaction, but we don't interact with our parents. They don't interact with us. You can imagine, 3 months you leave you may be probably in Entebbe working in Kampala, you have to leave your home at 5 in the morning, come back at 8 in the morning. You leave your child sleeping, you come back when she's sleeping. And of course, you're looking for school fees, yes, which is fine, but still there is that emotional bit you're killing. A human mind is comprised of 3 structures. That is unconscious, subconscious, and unconscious. But the biggest part is unconscious, which is formed when we are young. You get it? That's actually explaining the loneliness we are talking about.
Yes.
So from that time, the child perceives herself or himself as a lonely person, because the person, the caregiver, the parent who was supposed to be there, he's no more. And actually, it happens at the very tender, the first age, from 0 to 3 years. There is a psychologist called Erik Erikson. The one who defined that. That's when a child learns trust. That is from 0 to 3 years. So what happens at that tender stage? Your mother is given 3 months, only 3 months, so the rest of the 2 and 7 months you're with the maid, who's not actually, you know what happens? People keep changing the maids day, evening, because they are mismanaging or they're mistreating these kids, the guys. So just imagine what happens. So I guess, I believe mental health is not about the government, but family. The first person, the personality is in the family. Parents, mothers, fathers, the care we give to these kids defines who they are. The world, of course, it will just be a smallest percentage. But mental health, it should be in a family, not outside, not schools, not church, but in a family. The attachment, the care you give to this child, the nourishment, the direction you give this person, that sense of security. Mom is around, dad is around, I'm secure, I can interact with any other person. We all know that. You get, we all know that. Even when we are young, that you're playing with other kids, you know, hey, I will tell my mom. But right now, you will tell who? Even when the maid is hitting you. So this one, psychologically, in unconscious, it affects these kids. You say, okay, in the world, there is no one for me. And for us, when we are the people are lonely, no, it started way back. And I feel to solve that, we have to go back. We look at parenting styles. How are we raising these kids? It's not about money. I told one of the parents, he had a child at a rehabilitation center, and he was like, you know what, Katunguma, yes, I've taken this child to the best school, I've done this, I've given them the best meals, I have maids, I have workers, they don't actually do anything. Then I told you know what, sir, I want us to go step by step. Do you have a dog at home? He was like, yeah. I want you to write here what you give to your son and what you give to your dog. Apart from, was like, actually, he told me he had a German Shepherd that is trained. He's very good. So it's like, you give your dog food, you give your child food. There is someone training your dog to do something. Of course, this one goes to school. Like, there was no interaction. Have we ever sat down with your child and you're like, okay, this is done like this. And where do you expect him to get all these values? Not from your parents. Yes. Of course, the argument was like, for us, we grew up from this, we never had anything, this child has everything, but he's still using drugs, he's still misbehaving. No, we need that physical interaction. It unconsciously contributes to the well-being, the mental well-being of these kids. So, I'm not going to look at the government. Government should actually come. Of course, some policies, as I've told you, they affect our parents, they affect us. For example, the maternity leave of 3 months. But still, as a family, you have to weigh. Because we are raising a generation I can't even explain.
Okay.
Yes.
Well, Mr. Albert, I'd like to ask you, how can parents or guardians, help their children, especially who are going through mental health problems or issues? How can they help them best to cope or, avail them help in case they need any?
Number one is communication. Just as a rejoinder from what Rosette was sharing earlier, parents are kind of incapacitated their children by being so protective. And so children don't know how to relate with the environment. Everything is done for you from a tender age.
Yes.
So when you meet when you come out and meet what the world is exactly, then you do not know really how to cope. So parents should learn how to communicate with their children, number one, in a very open, respectful, and age-appropriate manner. And also give these kids space to learn on their own, to interact with the world.
Yes.
You know, that is from a tender age. Appropriate parenting styles. In the interest of time, parents can research these things. Parenting styles, just Google. They will come up, authoritarian, authoritative, all that.
Yes.
Then, but most of all, there are services now. You know, if you see something out of line about your child, you know, contact. Look for a counselor. You know, nowadays even people post for help on social media.
Yes.
You see?
Absolutely.
Exactly. We are there. Tranquil Homes, you can come. Call Rosette, you can come.
Yes.
You know, anytime. So, but most of all, have a relationship with your child. Leave appropriate communication channels. Be available. You know, and don't be overly protective, like I said earlier. So, help is available. If the parent thinks, let me just share something very fast. We have a teenage center.
Yes.
And this is the interesting part. We have so many people walk in or call to inquire about our services. They come, they bring their teenage sons. And after you've talked to them, you've assessed the child, you say the problem is here, and then you recommend that maybe this one needs to stay in for treatment for this time, because you really see that the person has developed a dependence or an addiction. The parents say, okay, let's go talk over it. Majority don't return. And then they call you later, okay, sorry, you know, we thought, you know, he's still young. It's a phase thing, it will pass. We took him to this pastor and things. So you find parents trying to wish this away. They are not dealing with these situations appropriately. Now, in our adult center, most of the patients we admit will reveal to you that their problems started as teenagers.
Yes.
At that point where somebody needed an intervention before this escalated. Now you're having them as adults. They have lost everything. They've probably failed to complete their education, or they are divorced. Their world is crumbling.
Yes.
That is now when they come for treatment. A good percentage of them fail to start again. You know, so parents should seek early interventions and not wish away these problems. Communicate with their kids. These are human beings. Tell them you've observed a problem and you think it's going out of hand. Others will argue, others will be in denial, and what? Just find that other person they are close to, if you as a parent are not close, and just let the person access a therapist.
Yes.
Yeah.
And that is absolutely true. Now, while we wrap up this conversation, in an article back in the day in the New Vision, they revealed that 14 million Ugandans are mentally sick, and according to the World Health Organization, 8 million people die worldwide because of mental disorders. Now, as a people who deal with these situations, who deal with people who are mentally ill, what's your take on this? You know, the statistics and how well, you know, how they can be reduced, because it looks like it's quite a number. It's a big number.
If you say 40 million Ugandans, then
14 million. 14
million.
Yes.
Yeah. Basically, I think it's even more than that. That was a soft landing for Ugandans. We usually say that everyone is insane. The degree of insanity varies. Yes. Mental health challenges are worldwide. They are widely spread, and they're quite significant today because people are more aware, and there are platforms for people to share this experience that I said earlier. But to me, the most important thing is that there is an ongoing conversation the world over. The Mental Health Week, for example, the one that the UK started, I think started 12 years ago. The Americans started much earlier.
21 years ago.
Yeah, but now we have this conversation going on in all corners of the world. That is what's most important. We are not yet there. but at least we've taken the steps in the right direction. The statistics may be alarming, but like I told you, that's just a soft landing. We all need help in one way or the other. Sometime I was called to talk to people in a law firm that had lost a colleague. It was just heart-wrenching seeing the entire law firm falling apart. They didn't know how to deal. And let me tell you, the interesting bit, it's the first time we had been invited by any work entity in this country to do grief counseling or grief therapy.
Oh, wow.
You see?
Yes.
So at least for us, it was exciting that at least we have been called. Even if it's one, it means that people are getting more aware. Yeah.
Anyway, Ms. Rose, this conversation is very intense, but we'd like to get your last remarks in regard to Mental Health Awareness Week 2022.
Okay, thank you so much. Personally, I would call upon the public to take keynote. First of all, the parenting styles. Secondly, the general perception about mental health. It's not about people being mad. It's not about people throwing stones and all that. Even stress itself, it can kill. And when we are doing diagnosis, you look at, for example, I was telling some of the students, when stress is prolonged for a very period of time, it's no longer stress. It goes to depression. Yes. Then after the other symptoms that come in, it comes to depressive disorders. That's why you hear people dying. So sometimes you find someone is looking at something, it's just stress. But that stress can escalate to depression, from depression, suicide, or something else. So even this the so-called mere things, even if it is a friend, you say, do you know what, I'm not feeling well, try to find out how is it, at what percentage. Can you sit and share? Even workplaces, you can be with someone who is actually performing very well, but is going through a situation that you can even not imagine.
Yes.
So I think let's seek for counseling services. It's not a sign of weakness, like, no, I've gone to see a counselor. No, those are services that we are supposed to offer. Then secondly, people who are using drugs, you can recover. Personally, I believe that addiction can recover. People can stop using drugs. There's something I was reading, it's in psychology. Drugs, they use them as source of pressure. So for someone to heal from using drugs, you have to be introduced something that is more pleasurable.
Yes.
So I believe addiction can recover if we put efforts together as psychologists, as rehabilitation owners, and parents, and we explain and give correct knowledge. We can redeem many lives. Because most of the kids that are using drugs, that are being affected, they don't know what they are doing. There are cookies now supplied in schools, and people don't actually know. Yes. So I think this should be for everyone to support, most especially the young ones, because now people are actually starting to use drugs in primary. So parents, please, I call upon you, let's be responsible parents.
All right, thank you so much for that input. Mr. Albert would like to get your parting shots in regard to Mental Health Awareness Week.
Yeah, thank you to the person watching out there. Take care of your mental health. Yes, it's important for you to seek therapy if it's significant, but you can maintain your mental health right from home where you are. You know, keep active, rest well, eat well, do your exercises. You know, go for regular medical checkups, because we know also physical distress will affect your mental health. Talk to people, and people out there, reach out to others. If you see something out of the ordinary about your friend, go and talk to the person. Let's be more concerned citizens about other people's welfare. So take care of your physical health, take care of your mental health.
Thank you so much. And that has been Mr. Albert Elwa Louise, who is an addiction professional, as well as a director focused on Recovery Uganda at Tranquil Homes. And this has been Miss Rosette Echansimira. Yes, and that is a clinical psychologist as well as a CEO, Epignosis Rehabilitation Center. And that wraps up the conversation that we had for you here on a Twitter Jabs 2 talking about Mental Health Awareness Week. This is Sunrise at Sea. Don't blink.